Please give Dr. Hartman a lot of hearts because he took time out of his busy schedule today to kind of answer a lot of the questions that you guys sent me. And I couldn't have done it without him. So just to be brief, a lot of you guys know me. I'm Kula, a dermatology resident in Brooklyn, New York, in my final year. So that's why I've been less active on Instagram because I'm preparing for the boards. But I promise in July I'll be back. And joining me today is a world-renowned dermatologist that everybody I'm sure know he doesn't need an introduction, but we'll let him introduce himself and then we'll get started with the program today.
Hi, well, thanks, Kula, for having me today. My name is Corey Hartman. I am a board-certified dermatologist. I am based in Birmingham, Alabama. I am originally from New Orleans, Louisiana, but ended up in Birmingham to go to residency at the University of Alabama. And I never left. I thought I'd be here for 3 years, and here I am 17 years later. I founded a practice here 11 years ago. It's called Skin Wellness Dermatology. We recently moved into a larger space and hired another nurse practitioner. So now we are 5 over 2 locations, and we have everything that you need to serve your skin care, hair care, mucous membrane, and nail care needs from birth to elderly ages. And we do, comprehensive skincare exams to cosmetics. So everything in between. My personal practice has veered more toward cosmetics and injectables and lasers here lately. But I definitely did my fair share of strong medical derm in the past and still have a presence and have medical derm patients as a part of my practice. So I'm happy to be here today, talk about men's health, skin health, and anything else that you guys want to talk about.
That's awesome, and congratulations on your new practice. I've been watching it on Instagram grow, so congratulations on that. And I feel like one of the reasons I didn't go away for residency is the same thing, because I didn't want to leave and then not didn't want to leave home and not be able to come back, which is kind of what happened with you in Alabama. So I'm happy you found that.
Yes, for sure. It's become home. So yeah, my wife's an orthodontist. She is part of a big practice here. So we're here for good, and it's been good to us. So
that's awesome. All right, so now we can think about men's skincare. And I think the problem with men's skincare is that a lot of men are not comfortable talking about it. And I think the reason for that is because of antiquated stereotypes that we have. And one of them is that usually skincare or skincare routine are usually targeted toward women. And I've seen like a lot of men, when they come into my practice, they're like, oh, if it's not manly. And the other reason that I feel is because of another stereotype is that men get better with age. Like when you like wash George Clooney, Denzel Washington, Will Smith. So they feel like they don't need any additional work because their body kind of take care of it. So what do you think about that, Dr. Hartman?
Yeah, well, I definitely think that, historically and traditionally, a lot of skincare products, services, and procedures have been really marketed toward women. They've been packaged in a way that would be better received by a female audience. And so that's who's received them well. Just like we've had a lot of discussions lately about injectables and other procedures in general and who they're marketed to. You could say the same thing about, they make arguments that Botox is something that only white women want and benefit from. And that's because only white women see themselves in the ad. So as the C-suite folks and the higher ups in the cosmetic companies see that there's a market out there for a diverse population of patients for all these products and services and skincare, we're going to start to see more patients express themselves who are not historically in the group that has been marketed to. So I agree with you 100%. Now, once you get men into the office, whether it's for a skin exam or, some other skin health issue that they have, then it opens up the door and you can really start to have a real conversation with them about how they can benefit from some of these anti-aging strategies as well. And I find that many of them are very receptive and very interested, but they are not comfortable starting the conversation. So men don't often come in scheduling an appointment necessarily for Botox. They might come in for something else, but in the course of the relationship and getting to know the patient, they will understand and start to learn about all the different things that they can benefit from, and then they can show their interest in a more comfortable setting. As far as the second part of your question, we talked about marketing, and then we talked about I'm sorry, the second part, I talked too much. I got
No, you
sidetracked.
don't. No. No, so no, the second part is just that I find that a lot is just also because of what the media feeds them. So when you watch men in movies like Denzel Washington, Will Smith,
Yes.
and then George Clooney, so
Sure. How we age gracefully. Well, that's
yes.
certainly true. And that is definitely a double-edged sword. It is a double standard, I should say, where women are scrutinized highly for any signs of aging and men are allowed to age more gracefully. That does not mean, however, that you want to just let everything go. And
No.
it means that the approach to the male aesthetic patient is different from the approach to a female patient. You want to approach it in a way that is less judgmental. Obviously, you don't want to be judgmental with any patients, but you want to go into it and allow men to save some of those features of aging that are more associated with a distinguished look. So we don't want to over feminize a man. We don't want to correct things to the point that he starts to look done more quickly. I think men look done more quickly and easily than women do when you start to tinker with some of the procedures that they do. But you know, by sharing my own story, I think that it allows men to be able to see that you can achieve these things in a way that just preserves and does not alter. Because that's really the goal for men, is to preserve what you have and not change, alter, or augment what you have.
Exactly, and that's what I usually tell my patient when they call like, "Oh, I age gracefully." I said, "Yeah, but there's something called premature aging, and believe it or not, a lot of it is due to bad skincare. So if you can prevent that, why not change that?" Uh,
Exactly.
so yeah, exactly, perfect. So yeah, so now they sent me a lot of questions. So I've broken them down into several categories. And one of the questions someone sent me is, "How is men's skin different from women's skin?"
Well, I think the main issue that men deal with that women don't really deal with is hair growth, facial hair growth, which can cause a lot of problems, particularly if your hair is dark, curly, and coarse and grows back in on itself. It can give you razor bumps or pseudofolliculitis barbae. You can get the hyperpigmentation that goes along with that. And then as men try different products to alleviate that issue, we can start to see dermatitis medicamentosa just to some of the products that they use, which can cause dryness and irritation and eczema kind of conditions. So that's the major difference between men and women's skin. But men's skin is also thicker, which is a protective factor against aging. It has more oil glands that accompany the increase in hair follicles. And oil glands make the skin thicker, but it also acts again as a protective factor against aging. I always tell my oily skin patients, look, that's a blessing in disguise. The oily skin patients, we're going to have issues with acne when we're younger. We're going to have concerns about pore size because our pores are just larger because they are attached to larger, more active oil glands that are releasing more oil. But that means that we're going to age a lot slower than our counterparts who have beautiful porcelain skin and tiny little pores, but tend to have dryness more easily, and that leads to wrinkling. So oilier skin, that's another reason I think that men age perhaps better or allowed to age more easily without a lot of intervention.
No, I completely agree. And I feel like also now, as a consequence, unfortunately, of COVID, we have Zoom meetings, and I find like a lot of, in the mask, I find like a lot of men are coming in now, actually for the first time wearing a bud, just like skincare, just to kind of like mitigate those complications. So, and I always tell my patient, the best skincare regimen is the one that you are going to use. If you're
Absolutely.
not going to use it, I can't give it to you.
And you hit on a very good point. Yes, you've identified that early in your career. Meet the patient where they are. I preach that skincare doesn't have to be super expensive and it doesn't have to be labor intensive, because I think a lot of people get turned off or they get intimidated when a person comes at them and is like, all right, I just need you to use these 8 things. It's like, whoa. That's too much. I really don't use 8 things. Now I have like 30 things in the bag, but at
Yeah.
any given time, I may be using 3 or 4 of them because, you know, life is too busy to, you know, be doing 10 steps. I don't understand this whole Korean craze
Yes.
either. I'm like, who are these people? They must be sitting at home with absolutely nothing to do. Sorry to interrupt you. Yeah.
No,
Keep it
that's
simple.
true. No, that's true. Because like especially men are very melanistic, and even like for the men in my family, even just getting them to wash their face with cleanser is like a big deal.
It's huge.
So yes, so I was just thinking for you, what else do you feel like the essential skincare step in a routine for men?
Yes, so the Holy Trinity applies for men as well. I have a Holy Trinity in Louisiana. I don't know. We have similar backgrounds as far as cooking and Creole culture, but we have the Holy Trinity of seasonings. So everybody knows that all dishes begin with those three seasonings, and a good skincare regimen is always going to have three components that are really going to take you 85 to 90% of the way. You have to have a sun protective factor or some kind of sunscreen. I don't care if you're, very dark, very light. I don't care what your skin type is. There's going to be a sunscreen that you can find that you will use, that you will like. But again, like you said, you have to really like it to use it every day because it should be a habit. You have to have an antioxidant that's kind of like the vitamins for your skin to prevent the breakdown of collagen. And then you must have a retinol or a retinoid. I prefer a retinoid. I am the king of exfoliation nation. I believe everybody should be using a retinoid of some sort. There's so many benefits that we get from that one product that it cannot be eliminated from the skincare regimen. So those are my three non-negotiable Holy Trinity products that everybody should have. And it really does not change just because we're talking about men.
No, I completely agree. And I see like someone has a comment in that's one of the controversies. Somebody said, I read sunscreen can lead to health issues. What? Oh, okay. So they went there. Okay. What can you please comment on that?
Sure. What can lead to skincare issues? Sunscreen. Oh, yeah. Let's talk about that.
Yes.
Okay. So sunscreen. So sunscreens are divided into two major types. We have chemical sunscreens and we have mineral or physical sunscreens. Chemical sunscreens are going to cause a reaction when the light hits your skin to make it inactive so that it can't have an effect on your skin to cause skin cancer or premature aging or discoloration or whatever. Mineral sunscreens form a barrier on the skin. So it's like putting like a mirror on top of your skin, tiny little particles of inert minerals that you cannot be allergic to. And they'll just reflect the light of the sun so it never even penetrates. Those are the type of sunscreens that I personally prefer. However, historically, they have not always been elegant for people with darker skin tones. We would put them on and we would look like a clown or have this iridescent cast. So that's why people tend to like the chemical sunscreens. But 25% of people are going to be allergic to chemicals and chemical sunscreens. And I don't know about you, Kula, but when I see chemical sunscreens, it's very rare that there's only one chemical included in the sunscreen. It's usually like 4 or 5. So if you have a problem with a chemical sunscreen, you can't even pinpoint which chemical it is to avoid that chemical in other sunscreens. So that might be, and I feel like every year or so, there's another issue with chemical sunscreens. I remember there was an issue with PAVA and whether or not chemicals cause birth defects or kidney cancer or whether or not they were absorbed into our bloodstream. Those are just the 4 or 5 things that I can think of since I've been in dermatology. So there are just a lot of unknowns. Whereas with minerals, we know that they don't absorb. We know they sit on top of the skin. The only issue has been their elegance. And because of the persistence of dermatologists of color like myself, pressing these companies to continue to formulate better products that all patients could use in a way that was pleasing to them. Now we have a lot of options that we can use and be protected from the sun and not worry about the chemicals.
No, I completely agree because I remember when I was in high school, you could not pay me to wear sunscreen because I always feel like when I put it on, I look like a clown because of that tan.
Yeah, nobody wants to look like that,
Exactly.
So,
but now because we have like better formulation, I find myself wearing it more often than I used to, even though I'm not ideal at it right now, but I'll get it.
Sure.
So perfect. So I told somebody asked about razor bump, but we'll get to that soon. It's just like, so like we discussed before that men's skin tend to be oilier, and I feel like there's a lot of myths out there regarding moisturizing your skin and that the oil component of your skin. And I always try to educate my patient that just because your skin is oily does not mean you do not need a moisturizer. So how do you approach that in your practice?
Right. So when we're talking about skin, we need to make sure that we are being specific about what we are saying. So there's oil content and then there's water content. The water content really has to do with the dehydration of the skin and how well hydrated your skin is excuse me, and the oil content has to do with the barrier and how well that hydration is trapped in. So if your skin is dehydrated, lacking water, and you don't moisturize it, your skin is going to try to compensate by producing more oil. So you'll often see that your attempts to curb the oil are futile because you're actually working against yourself and setting yourself up to just produce more oil. Now, there are different types of moisturizer. There are cream-based moisturizer, serum-based, oil-based. There are a lot of different, products that you hyaluronic acid that you can use that can replenish the skin in a way that will be pleasing to you, that will help you to control the oiliness as well. So I think it boils down to kind of what we were talking about before, where you have to, and I know it's hard because there's so many different products and we can't open Instagram without being marketed to from 45 different companies. But that's why it's important to have a dermatologist in your life to help you make sense of it all, to help you find the right products for you so that you can be as successful and as you can optimize your skin results with as few products and steps as possible.
No, I completely agree with everything you say. So now the question that I get even from like my family, the men in my family, so like you said, when you open Instagram, TV, like commercial, they always show like women using all those skincare products. What is your go-to skincare brand for men?
All right. So I mean, that's such it's a big question. Let me tell you, I will tell you, okay, let's talk about the Holy Trinity, right?
Yes.
Let's talk about those three, and I'll tell you my favorites for men of those three.
Okay.
Because I don't personally believe that one, of course I love Old Spice, right? For body wash and deodorant and all those things. But when we're talking about like a personal skincare brand for your face, I don't think that one company does everything very well. Like it doesn't do everything right, right? Most companies are founded on one product and then they build this array of products around them. So if you come to my office and get a consultation, we're really going to talk to you. And we have already curated the best of the best from each company. So we're generally not going to send you out with 5 things from the same company, unless it just happens to work out that way. But so men don't like heavy sunscreens, sunscreens that smell, sunscreens that leave a film. I really like Isden Aerofitona Actinica. It's a light emulsion. It's really nice. You can put it on, forget about it. Nobody's going to know you have on any kind of anything. As far as antioxidants, I like either Illumier Everclear or SkinCeuticals Floritin CF because, again, light has a decent smell and it goes on in a way that is invisible. And then as far as my antioxidant, if we're talking non-prescription, Skin Better's Alpha-Ret is unparalleled in my opinion because they can combine a retinol that is of prescription strength with a glycolic acid. And most people don't want to use a retinoid because it's going to make them peely. I don't know how they've done it, including glycolic acid, but they've managed to formulate it in a lotion that does not leave peeliness or dryness or irritation. So those are kind of my go-to 3 for men getting started on a regimen. So yeah.
No, that's awesome. I thank you so much. Yeah, because I get that question a lot also. I'm not well versed with like all the products out there, so you're the expert.
Sure.
We can like tap into you to see what more you can add. So
and let me say this. Let me also add a good drugstore brand because I think that's important for access. Vichy, if you are kind of new to skincare and you need alternatives that are, inexpensive and proven by science, Vichy has wonderful products. They have antioxidants, retinol, sunscreens. They have everything. You might still need a little help picking out the exact right one for you, but that would be a good place to go for a reliable, science-based drugstore brand.
No, so thank you. That's awesome. So now we'll shift gear to an area like you mentioned, like men are more hairy than women. So, and unfortunately, they suffer from like razor bump because people shave or like ingrown hairs. So, what do you recommend in terms of like before and after care for men when for shaving?
So I like a gel-based gel to foam shaving cream. I think that hydrates and lubricates the skin in a way that allows a razor to glide over in an effortless manner. I personally prefer a blade to an electric shaver. I think you can get a more precise shave that way. And I don't recommend if a man is having a lot of severe pseudofolliculitis or razor bumps and the area is very irritated, maybe we start with a razor with, you know, fewer blades and then work our way up as we get clearer. But more important than the actual razor is the way that the razor is used. If a razor has 5 blades, then you can think about that as cutting the hair 5 times as it glides over. So if you're already cutting the hair multiple times with multiple razors and a blade, or blades and a razor, then you definitely don't want to do this thing where you're going over and over the area multiple times. All that's going to do is cut the hair shorter and shorter, which might sound like a good thing, and it'll give you a good shave that very first time. But remember, that hair has to grow back out. And the shorter you cut the hair, it's going to retract into the skin, making it more difficult to grow out. As it starts to grow out, that's when you're going to start to see the bumps. Not that first time, but as the hair starts to grow back out. So be deliberate. You get one glide each time. Learn the direction that your hair grows. Generally, that's going to be down on the face and up on the neck, but you really need to get into the mirror and learn how your hair grows so that you can optimize your shaving pattern to be as precise as possible. I am old school. I know that I don't think there's any science behind this, but I like to start with a warm compress before. I do think that it just prepares your skin for shaving better. Either wash your face or just, you know, apply a warm towel before you shave, and then really pay attention to the direction that you're shaving in. And just accept the shave that you get. You know, that will be your shave. Don't try to go over it over and over again. Again, you're going to be setting yourself for issues later. So those are all my steps and my tips for successful shaving. And then I also am an advocate of laser hair removal for problematic areas. So most men, if they're going to have a lot of really bad razor bumps, they're typically either in the goatee area or on the neck. And I always say you can have a full beard without having hair on your neck. So those areas can be more difficult to treat, and it's a good idea just to kind of get rid of that hair on the neck, and that will save you a lot of time. You can still grow your full beard.
So, oh yeah, awesome. Thank you. Someone is asking about the red bumps after shaving. I think they're referring to irritation. So how do you, can they manage that?
Yes. Yeah, I recommend a good moisturizers, obviously, but sometimes you have to add a steroid. You just have to use a steroid cream and have it around for those bad days, you know, and this isn't something that we're going to advocate that you use every day, all the time, but on the days that you shave, if you see some more irritation that you want, calm it down with a nice steroid cream, and then always use your retinoid in that area as well. You're going to get all the same benefits that you'll get everywhere else, but you get the added benefit of increased exfoliation, which is going to help the hairs to grow out and not become ingrown hairs.
No, I agree. And that's actually is the only time where I can get my male patient to actually use a retinoid.
Yeah, it's another benefit.
Yeah. But once I tell them you'll help with their ingrown hair, they're like, okay, you got me.
Exactly.
So yeah, so thank you for all your advice. So then actually the next question is like regarding a different topic, is sweating on the face. So a lot of men usually come and they complain like one of the reasons why they don't like putting like stuff on their face, like moisturizer and everything, is because they find that sometime throughout the day they happen to sweat a lot and they feel like they're wiping it off. What advice do you have regarding that?
Well, I get this question a lot across multiple different patient types, and I think it's just a lack of understanding of how these products actually work. Because except for sunscreen, which is going to form kind of a barrier on top of your skin, the goal for the rest of your skincare is to really absorb into your skin to where it's going to be more effective. So I generally find that if you apply your skincare and, you know, give it 30, 45 minutes, maybe an hour before you profusely sweat, you're not really going to sweat it out or sweat it off like you think that you are. Now, that is an issue for sunscreens that do sit on top of the skin and can become you know, runny and run into your eyes and cause your eyes to burn. But there are more water-resistant, sweat-proof sunscreens that you can investigate as well, that or research that can help to alleviate that problem as well. But I think that if you have the right skincare products, they're going to absorb into your skin, and you're really not going to have that issue.
No, I completely agree. But what about for your patients who are like on the extreme end of that, where they sweat no matter what, to the point
Right.
where like at that point you have hyperhidrosis? You go
Yes.
for Botox in that area.
Botox for sure. If you know, a little Botox never hurt anybody. We can do it even in the
Yes,
scalp. I mean, it's the truth.
that's
And
true.
so, and you can do baby tox, micro doses, where you're targeting a particular issue and not necessarily trying to slow down the prevention of lines. But why would you not want to also slow down the prevention of lines and wrinkles, right?
Exactly.
And you know, there are other methods of controlling sweating as well. There are some glycopyrrolate towelettes now that you can use. They're really indicated only for under the arms, but as long as you're not having any irritation, I tell patients you can use it wherever you are having more sweating. And there are some pills as well that you can use to control the sweating if none of those other methods is sufficient.
All right. So regarding glycopyrrolate, since you brought it up, just like there are different practices in our community, so do you prefer it in the morning or at night? The use of it.
I usually say use it in the morning. Most patients, the only side effect that I've really seen patients have with it is that if it's dosed too high, they will have control of that nerve plexus in other areas. So in other words, the same nerves that are controlling the sweating also control your eye's ability to tear and, you know, saliva. And so you might have dry eyes or dry mouth. And so, yeah, I find that it's better to know that by using it in the morning and getting the full benefit of the product being fresh in the morning than to kind of waste it at night and deal with dry eyes when you're trying to sleep. So, yeah, I generally say to dose it in the morning. And then we also divide doses if patients find that that is something that works better for them.
Okay, perfect. Thank you. So now we'll switch to hair loss, which is like a topic that I feel like that's like one of the few topics that I feel like will get men into my office really fast once they start, like really fast once they start experiencing any form of hair loss. So can you comment on the most common cause? Because a lot of my patients, like when I try to explain it to them, they don't understand how much genetics actually play into male pattern hair loss. Can you give us like a little background and like even like how your recommendation for your patients?
Yeah, so you're right. We don't exactly know how genetics plays a role. There was some, you know, when I was a resident or maybe before that, there was this thing about, oh, it's your mother's father, and you could just look at your maternal grandfather and know what your future held. And we know that's not necessarily true. It's way more complex than that. It's multifactorial. We know that there's a genetic component, but we don't understand exactly how some people get the gene for thick, full hair, and then how some people get the gene that makes them start losing their hair, you know, in their teenage years. The most important thing that I tell patients is by the time you've noticed the hair loss, about 50% of the hair has been lost. So as soon as you figure it out, you really need to seek treatment to find methods to not only prevent the loss, but also try to thicken what you have. It's always, I always say when we start Propecia, which is finasteride, which is the main oral ingredient that, or main oral medication that we use to treat hair loss, a successful treatment is if you don't lose any more hair.
Yes.
If you hold where you are, we consider that a success. So that's always a part of the plan. It's easier for most men to just take a pill every day. The cost of that product has come down tremendously. You know, it used to be $75 a month. Now you can get a 3-month supply at Costco for like $7. Always Propecia, very few side effects. Propecia works by stopping the conversion of an enzyme. I'm sorry, conversion of a hormone that has receptors on your hair follicles. So when regular testosterone is taken to a stronger version of testosterone, there are receptors on your scalp that make that hair grow lighter and finer over time. So if you can stop that progress of that conversion, then you're going to be doing yourself a big favor. I like to add on to that PRP treatments, platelet-rich plasma with growth factors. That is tremendously helpful in a combination of other treatments, provided that you get on it, you know, early enough. So those are kind of the main ones that I like. Then there's also topical minoxidil or Rogaine, which has a role. It just takes more work. And it can cause you to have hair growing in places that you didn't intend. And then I have started in the last year to prescribe oral minoxidil as well,
Me
at
too.
the urging of some of my hair, colleagues who do this a lot more than I do. And I've been really pleased with it and its ability to regrow hair with, few side effects and a very low cost. So you've had some experience with it as well?
Yes, exactly. So that's after one of the Skin of Color Update conference. That's when I started using it. And I
Such a
actually,
great meeting.
yeah, it's amazing that meeting. I learn so much every year. I just and I can easily get more patients to actually use the minoxidil compared to the Propecia because of like the hormonal side effect from Propecia. Because once I go
Yes.
down that night with them, a lot of them, especially if they're younger, they're like, "Whoa."
Yes, I know. They get nervous. I know. And I try to stress the fact that I think that there was something about the person who wrote that paper actually came back a few years later and said that that wasn't true. He had been influenced by Rogaine,
Mhm.
to promote those things. But I've only had one man in my practice who suffered some sexual side effects as a result of Propecia, and he was like 60 something years old. So I'm not sure if it was the medicine or just nature taking its course. But I also want to give a shout out to Skin Medicinals or Hair Stem,
Okay.
and our friend, I don't know if you know Davo Banasali, Dr. Davo Banasali in New York City, but that's
No.
his company, and he's figured out a way to combine not only minoxidil, but finasteride, spironolactone, all of the, even some bromodoplast, into one product that's affordable that you can just spray on or drop on. So that's given patients another option than just the regular minoxidil at the store. You can compound it even higher than the 5% that you can get at the drugstore.
Oh, that's amazing. And
Yeah,
for the person asking, so Propecia would be a prescription medication. It's not available over the counter. So you would have
exactly.
your dermatologist for that.
Yes.
Perfect. Very interesting discussion. Thank you so much, Dr. Hartman. I'm enjoying this.
Yes.
So the next thing, so we'll stay in the scalp. So I feel like a lot of like Afrocentric male, they suffer from seborrheic dermatitis.
Hmm.
A lot of my patients will like do dreads, cornrows. They always come with very frustrated dealing with that and managing that. So what is like common advice or tips that you have for them, especially like when my ketoconazole is not working?
Yeah, so the first thing that I always tell my seborrheic dermatitis patients is that there is no cure and that this is something that they will deal with. Now, how much they deal with it depends upon the products that we choose and how they incorporate those products into their lives. I like to control as much, if it's on the face, that's something that you're going to be presenting to the world and can really impact self-esteem, etc. So we try to get that under control relatively quickly. I like cleansers with zinc. Again, I don't believe in adding a bunch of steps, a lot of extra work. You're already washing your face. Let's just plug in something that can be a little more effective. And instead of
Yes.
just ketoconazole, because I feel like everybody's been on ketoconazole from their primary care doctor. So I rarely will prescribe that. But I do like to use, it's a bar by Vanacream called the
Yes.
Z Bar. It
Thank
has zinc.
yes.
Yeah, it's fantastic. It does the majority of the heavy lifting. And then, we might try some ketoconazole cream if they have breakthrough. Very rarely, I'll do a very, very low potency steroid cream or sodium sulfosetamide to control it. And then in severe cases, I find that some patients really do need to be on oral zinc. A lot of times, Kula, as a dermatology resident, when you get out, you'll notice if you ever have any real difficulty in getting something clear in skin, try a little zinc.
Yeah.
Skin loves zinc.
Thank you.
Um, that's great. And then on the scalp, it really depends on the hair care practice of the patient. It depends
Yeah.
on the hair texture of the patient. But I do like I mean, I do like salicylic acid, or I
Mhm.
like an acid, just something to get in there and break that scale up, particularly if it's very thick when they first get started. And then on the scalp, that's a place where I'm more lenient with my use of topical steroids.
Mhm. Perfect. Awesome. Thank you. Yeah, because that's like something that we deal with a lot. I feel like all my patients comes more for hair issue than for facial issues. So the next one is acne. So we cannot talk about skincare without mentioning acne. And I feel like in men, it's usually present more of a challenge than in women because like, especially your bodybuilders, because they're taking all those supplements and hormones, proteins that there is some data for that can make it trigger the acne. So make it more of a challenge for us to control. So how do you approach those patients?
Well, yeah, acne patients and skin of color, in my experience, are often more distressed by the hyperpigmentation than they are by the acne. So most patients come in and complain about the discoloration, and then we have to educate them about the fact that it's really their acne or folliculitis or something that's causing the discoloration to begin with. Again, retinoid, huge. It's going to give you anti-aging. It's going to give you skin evening. It's going to give you acne control. So a good retinoid is essential. And I always get people on, or patients on, a retinoid that they can tolerate. And we do a lot of education to get them up to speed, because the worst thing you want to do is give somebody a retinoid, promise all these great things, not tell them what to expect. They start using it a week or two in, they get very discouraged because they have a lot of irritation. They don't know what they're doing. They don't know how to go slowly with it. And then you've lost their confidence and they think that retinoids are not for them, or that they're allergic or whatever. So, you have to be really deliberate about how you educate patients about retinoids, because again, so many benefits, but just a misunderstood medication.
No.
Um, yeah, and I like Accutane for severe cases when, scarring is present, and other things have been exhausted. And oral antibiotics still have a role, although I'm finding myself writing fewer and fewer these days, long term especially.
No, I completely agree. So in terms of retinoids, how do you get your male patient to use it? Because I feel like it's easier for me to get my female patients, because like they tend to be more compliant, because like they usually want the progress rates fast, so they will follow all the instruction. But I feel like for male, it's usually more difficult to get to them, especially once I mentioned that, you might get the part where it might get worse.
Right.
So I think like tolerating the retinoid is always like one of my main struggle with men. So what are your tips for that?
So we have a whole handout, but I recommend there's some really good retinoids now that are in moisturizing vehicles. So that's one thing that you can do to try to mitigate some of that. Think about, men also have oilier, thicker skin, so they're going to inherently tolerate retinoids better than women. Even if they're not as patient with it, they are going to just tolerate it better. Think about the time of the year and ask about their lifestyle. If there's somebody who, skis for a living or whatever outside in cold temperatures, then no, you might not want to start with a strong retinoid. But kind of prepare them. I tell them, look, it's going to be 4 to 6 weeks of an induction period. We'll see you back in 8 weeks. At that point, if we're on the right track, we should be about 30% better. I tell them this, the nurse tells them this, they get it on a handout, because I can't tell you how many times patients like don't remember what you say. So the more you can reinforce it, the better, because nobody's really, you can tell somebody it's going to peel, you're going to have dryness. You can tell them that, but until it happens to them, then it's like, oh my gosh, what is this peeling? They forget that 4 different people have told them that. As far as the purging or the fact that the acne may get worse, for men, I understand that you often get one chance to prove yourself to a guy or teenage boy. So I like to give him an oral. I tend to write more oral antibiotics for men than I do for women or teenage girls, because I know that you kind of have to show them quickly. So while, that will help to protect against any purging that the retinoid might bring, is if you have an oral antibiotic on board.
Thank you. And somebody is asking, do you have any thoughts on BP wash?
I love benzoyl peroxide cleanser. Yes, I think it's a great adjunct treatment for acne. I use it a lot in the scalp for pseudofolliculitis. I mean, not for on the face for pseudofolliculitis, for acne keloidalis, for dissecting cellulitis. It is a wonderful tool, provided that you can keep it away from your textiles, because it will bleach the washcloth. I don't like leave-on benzoyl peroxides, especially for skin of color, because we know that darker skin tones can be more easily irritated. So I do it a lot, but I only do it as a cleanser, not as a product that stays on the skin, because you can get more irritation that way.
Okay, sounds good. Yeah, and CeraVe has one where it's like one of their newer cleansers that has benzoyl peroxide. I'm using actually right now. It's actually pretty good.
Not too dry. That's good.
Yeah, yeah, exactly. And so the other questions, because you brought it up, that was going to be my follow-up. Acne keloidalis, because it's very common in Afrocentric populations. So how do you, because a lot of men, they will actually do shave that area and get those bumps. They usually don't want to stop getting that hairstyle. How do you,
Right.
I feel like a lot of, especially when it comes to skin or color, a lot of the recommendation that we have are culture insensitive, or just stop doing this, just stop that.
Yeah.
this. So I feel like it's more like of working with the patient so that they can kind of be able to have the lifestyle they want, and also manage whatever complication they're getting from that. So how do you usually address that for your patients?
Yeah, I think it's really ironic that you say that because that is true. I find in dermatology, historically, for any black issue, it's just like, oh, we'll just stop doing this or stop doing that. But, I've seen patients who never cut that area of their hair, who, have very like soft, straight hair, who still have issues back there. So it's more than just stopping a practice. I think that there is also a genetic component that goes into it. So I typically will start very aggressively in treating that area with high dose antibiotics, more than one at a time, not for a long period of time, but for, a good month, with a benzoyl peroxide and a cleanser, and then a really strong topical steroid. And we start with injections as well, because we know that the inflammation will lead to scarring that's really difficult to control. Once the scarring takes place, hair loss occurs, bumps can form that can, meld into a one big keloid, which is more difficult to treat. So medical treatment early on is very essential to calm it down. And then once I get it down, we manage any residual scarring with intralesional topical steroids. And I will occasionally continue with a different antibiotic that can be used long term. But with some of these topicals that are out now, especially one called Amzeeq, it's a minocycline that's great for acne, but I've been using it off label for all sorts of issues. And this is one of those where you can use it instead of using the oral antibiotics. So yeah, you have to be aggressive with it at first. And once you get control, then you can start to space out the treatments and space out the visits. But again, I recommend, look, I tell patients, we're going to get this better, but this is not a cure. If you stop doing everything, it can come back with a vengeance, and then it'll be more difficult for both of us.
No, I completely agree. So thank you so much. And we'll end with like the final topic that a lot of men have question about is hyperhidrosis. So always like the question that I get, in addition to controlling that, is like the smell really bothers them, like what deodorants that you recommend. So if you can comment on that.
Sure. So there is antiperspirant, which is controlling the sweating. That's going to have aluminum salts in it. And then there's going to be deodorant, which does not have aluminum salts, which can be less irritating. And some products contain both, right? So, of course, I always have to put in a plug because I helped to develop the Gentleman's Blend Old Spice, and also the Ultra Smooth collection that have wonderful fragrances. A combination of both antiperspirants and deodorants, finding the right one for you is important. After you have gotten a good base of, controlling the sweat and controlling the odor, if that's not enough with something that you get at the drugstore, then you can explore more medicinal or prescription strength products. There is a condition called bromhidrosis, actually, where the bacteria combines with the sweat to give off, it's not just a regular body odor, it's a different kind of odor that deodorant cannot help with. And so those patients need topical antibiotics that we use in that area. In my state, Blue Cross of Alabama, they actually cover, and they're the majority, payer around here. They cover Botox injections every 3 months for hyperhidrosis.
Wow.
And yeah, you can get it in palms, soles, or under and axilla every 3 months. So that's a good benefit. And then we have patients who don't have Blue Cross who pay out of pocket because they see the benefit of having Botox injections there as well to control the sweating. So a mouthful, but yeah. And then if you have excessive sweating all over the body, we've already talked about glycopyrrolate, which is a wonderful way to help control sweating when it's more diffuse. And it's just not, it's not going to be practical to apply something all over your body. It's just easier to take a pill and help control the sweating that way.
All right. Thank you so much, Dr. Hartman. And thank you so much for giving us all your time today to answer all these questions. And everyone, thank you so much for tuning in. You guys can always DM me any more questions. And if you guys have more questions and Dr. Hartman has more time, we can definitely schedule another session. But I cannot thank you enough for all your insight today.